Can you hear me, Margaret?
Oh, hello. There you are. Well done, Hannah.
Oh, great.
Can everyone see and hear us all the way out there?
Oh, we can hear you loud and clear.
Hi, everyone, and our thanks for agreeing to meet with us today with myself, Di, our Director of Nursing, and Alan from the Royal Flying Doctor Service to discuss Emily's case today. I'm very keen to hear any suggestions you may have about Emily's management and ongoing care.
Good morning, Margaret. I believe you know Greg and Ben from Paediatric Cardiology Team.
Hello.
Yes, hello again.
And I'd like to introduce you to Shanoa from Paediatric Palliative Care Service.
Thanks, Hannah. With me here today is Amanda, our Paediatric Palliative Consultant, and
Twen, our social worker.
Hi.
Hello.
Amanda, would you like to take it from here?
Hi Margaret, I am sorry to hear that Emily is unable to have more surgery and that she's not able to have a heart transplant. Now, as you know, our team would like to work with you and the cardiology team to give her the best quality of life we can and also to support the family as much as we can. Now, one area we'd like to focus on is pain management and other symptoms. Are any of these an issue for Emily?
She's having increasing difficulty breathing.
I see here that Emily already uses oxygen at home when she's breathless. Does Emily also have a portable oxygen cylinder that she can use when she's away from the house?
Well, Emily had an exacerbation of a condition about 6 months ago, which is when we first ordered the oxygen. Her breathlessness seemed to settle down for quite a few months after that. I was surprised at how soon it is now since her last episode. She's recommenced using the oxygen this week with moderate effectiveness. I would like to organise a mobile oxygen cylinder because they mentioned on their visit that it helps Emily when she uses the oxygen. She has 2 large standing cylinders because they live out of town and often rely on a generator or solar power. I know Emily's keen to get back to school to visit her friends. It would be helpful for the palliative care team to connect with her school about the care of the oxygen equipment.
what about Emily's parents? How are they coping with things?
Emily's parents own a large cattle property out of town. Robert works 7 days a week on the property, and Melissa's had to take a job in town 2 days a week to help them financially. They also have 2 other children, Jacob and Ryan, who are 6 and 8 years old, and they can be a bit of a handful. Emily's had quite a bit of time away from school lately, and I know that Melissa's been helping with her schoolwork as well. When they came in yesterday, Melissa looked tired and physically run down. To be honest, I don't know how Dad is coping. I never see him. And I rarely get the chance to ask Melissa when she brings Emily in to see me, well, even how she is managing with all of this, to be honest. I would really like to assess this properly and see if we can provide some support financially as well as emotionally.
Margaret, I will talk to Shanoa and Hannah. We will discuss what further assistance and financial support might be available. It is often what we see. As you described, the dad is busy trying to financially support the family, and it can be difficult to get his perspective. We can connect with them at home with an adults-only conversation to explore some of their shared and individual concerns.
Margaret, have you had a conversation with Emily and her family that her condition will deteriorate? I realise this can be difficult to do, and she may have periods of stability, but it is likely that they will see a steady decline. The time frame we're dealing with in terms of life expectancy is still uncertain. As you know, with complex heart disease, it's possible that Emily could have a cardiac episode or even an infection, such as influenza, within the next 12 months and not recover. It will be important now to manage both her physical symptoms, such as pain and shortness of breath, as well as provide practical and emotional support. It would also be a good idea to discuss a plan about what to do if Emily should have a sudden deterioration. This could include a sudden worsening of her symptoms as well as an arrhythmia, which could lead to a sudden decline and possibly even sudden death. We've developed a resuscitation plan to assist with this discussion and would be happy to share it with you. And again, I acknowledge this will be a very tough series of conversations for you to have with the family.
Yes, it's a very difficult time. I mentioned to Emily and Melissa that I would be including the Paediatric Palliative Care Service in her care and explained what that means. Emily was upset by this. I explained to her what you do as a service. I haven't spoken to them directly about Emily's condition deteriorating and what that may include, but I'm sure they're very aware of it. I have found it hard to discuss. I'm not really sure what to say to them. From the things that Emily's been saying recently, I think she knows she's going to die, but she doesn't seem to want to talk about it in front of her mum. I get the same feeling that Melissa doesn't want to admit it in front of Emily.
Yes, it is hard to discuss, but it is an important conversation to have. It is actually not uncommon for parents or children to understand the seriousness of the illness and know that death will happen, but they just don't like discussing it. We will set up a family meeting online with you, Emily and Melissa. We would like it if you could organise it so that Robert can be involved as well, and then we can all sit together and discuss what's likely to happen and what steps to take.
Well, that sounds like a great approach. And I'm sure we all look forward to meeting and planning together again soon.